Hello, I am Brittany Fontenot, a second-year graduate student in speech-language pathology, and my presentation is on unilateral visual neglect in persons with right hemisphere damage. In this presentation, I will briefly discuss damage in the right hemisphere, left visual neglect, as well as its effects and examples, associated brain structures, the research associated with neglect, as well as treatment approaches. Various factors can contribute to right hemisphere damage. These include stroke, tumors, infection, as well as traumatic brain injury. Here, this slide depicts the neurological issues I just mentioned. The first image is a right hemisphere cerebral infarction. Then you will see a tumor in the right frontal lobe. The next image displays an infection in the right hemisphere. The source said that it was cerebritis due to direct spread from otitis media, mastoiditis, sinusitis, or dental infection. And then the last picture, we have an intracranial hemorrhage resulting from a traumatic brain injury. Since we are discussing the right hemisphere, contralateral, or I suppose in this case contralesional, functions indicate that neglect would be on the opposite side of the body in relation to the location of the damage. So right hemisphere damage often causes left visual neglect. A person with this deficit does not respond to stimuli on the left side. This includes neglecting left limbs, left side of space, or even tactile or sound input on the left. One study described people with left visual neglect as people who have a compulsive right skewed gaze. A study by Lundvin and his colleagues in 2015 found that up to 85% of persons in the acute stage post-right hemisphere CVA suffer from left neglect. So that's quite a bit of people. Left-sided neglect causes debilitating effects such as poor safety awareness. People are at an increased risk for falls or other injuries, such as getting their left arm stuck in the wheel of a wheelchair or brushing up against the wall as they're walking. Some people even feel as though their left ligaments are no longer attached to their bodies. This can cause severe psychological and emotional distress. Left neglect also impacts a person's ability to independently perform basic activities of daily living. These include dressing, toileting, feeding, etc. So why does this matter to the speech-language pathologist? Along with the cognitive communication problems such as attention and memory deficits, a person with left-sided neglect may struggle with the inability to follow directions, unless the person has the strategies and awareness to overcome the neglect, of course. For example, during dinner, if the person with neglect is asked to pass the salt, and it is on the left side of the table, he or she will not be able to follow through with that command. Last semester, I had a patient with left-sided neglect due to a right hemisphere CVA. During mealtimes, she would have food on the left side of her face, however, she couldn't feel it. She wasn't aware until I brought it to her attention, either verbally or with a mirror. She had to learn to frequently wipe that left side of her face periodically during mealtimes. Another example is if someone's trying to get the person's attention by either tapping his or her arm or speaking into that left ear. He or she may not feel it or hear it on the left side. The next two slides are examples of people who have left-sided neglect. So this picture is a person who copied drawings, and then you'll see during meal times they'll only eat half of the food, and then this guy who only shaved half of his face. There's a very interesting novel written by Dr. Oliver Sacks called The Man Who Mistook His Wife for a Hat and Other Clinical Trials. I highly recommend it if you are interested in unusual neurological cases. In one particular case, a woman with left neglect could not find the coffee on her hospital tray. She thought the nurses were forgetting to give it to her each morning, and in reality, it was on the left side of her tray. She also thought her food portions were too small because she couldn't see it all. The chapter went on to say that she even would put lipstick on only one side of her face. So very interesting. And then this is what a person would typically see. Lundin and his colleagues also found several lesional predictors of persistent neglect. They are depicted on this slide. So these are some things that we touched on in class as well. In addition, their 2015 study found that axonal degeneration of white fiber tracts, which occurs days to weeks following the CVA, appears to be related to chronic neglect. So neglect results from a large-scale dysfunction rather than from focal damage alone. The image here shows the relationship between the white matter damage and the severity of neglect from their study. Another study conducted in Taiwan by Dai and his colleagues in 2014 sought to determine the perceived quality of life of persons with anosognosia and left-sided neglect, both which are prevalent in persons with right hemisphere CVAs. Anosognosia is the lack of awareness or underestimation of a specific loss in sensory, perceptual, motor, cognitive functions, all caused by the brain lesion. Quality of life, of course, is dependent upon many factors, including age, gender, education level, motor function, comorbidities, things like that. So there's a lot that impacts that as well. The patients with neglect who were aware of their deficits in this study reported an overall lower quality of life. Spatial neglect either spontaneously resolves or persists post-stroke. Neglect is also believed to persist due to an imbalance of connectivity between hemispheres. Several researchers have found that persistent factors include the strength of functional connectivity between the right parietal and left prefrontal regions. And here's a picture of the functional connectivity of the right posterior and parietal cortex in the initial acute examination in patients with the visual neglect. Other neglect persistent factors include elderly age group, dementia, anosognosia, hemianopia, and severity of neglect in the acute stage. So what do we do about this? Treatment approaches include visual scanning training, so actively and consciously paying attention to stimuli on the affected side, usually just by starting a few degrees past midline and going out from there. So tasks can include mazes, mealtime activities, and reading tasks. Sensory awareness, this can be tactile stimulation in order to increase the awareness of the neglected side. Spatial organization training, auditory feedback, and video feedback. And then hemispatial sunglasses, which, if I understand correctly, shades the unneglected side to draw attention to the neglected side. A more positive finding was that of Osawa and Mishima in 2011. They studied neglect intervention programs that involved the patient's family members and compared them to those that did not. So, though most patients with the neglect following stroke exhibit gradual spontaneous improvement, many do not. So, the findings of this study indicated that active stimulation involving the cooperation of those living with the patients was directly related to the recovery of the neglect. So that's an encouraging note. And this slide just shows the results of their research, and that family participation improved not only the mobility but also the neglect and performance of ADLs. And the take-home message is that many people suffer from unilateral neglect due to right hemisphere brain damage. So how do we intervene? Improving neglect outcome requires a better understanding of the mechanisms associated with impairment and recovery. And thank you for watching.